Matt Jameson Evans. I'm Chief Medical Officer of HealthUnlocked.
I'm Will Dixon. I'm a consultant rheumatologist at Salford Royal and a Professor of Digital Epidemiology at the University of Manchester.
I'm Goran, Nenadic. I'm Professor of Computer Science at the University of Manchester and lead for the UK Text Analytics Network.
So we've come together to solve one of the problems around medication safety. So 1 in 2 people in the UK take prescription medications, and as you start to take them you need to weigh up the benefits and the harms of treatment, and so therefore we need to have a really clear understanding of what those potential harms are. One of the ways that we understand about drug safety is that people report through to the regulators like the MHRA, but we know that there's a massive amount of underreporting. But what we do know is that lots of patients are sharing their experience on social media about what happens when they start to take medications.
And from our side, we've, over the 7 or 8 years that HealthUnlocked has existed, we've seen just countless conversations about medications that include potential adverse drug reactions. What we've never been able to do before is anything other than just support the conversation. Whereas what we'd like to be doing is not just leave those conversations hanging in the wind, but seeing if there's something useful that can be done both for research but also practical application of what happens to an adverse drug event.
So technologically, there has been a lot of work on trying to extract information from social media and healthcare posts. The main challenge here is that the text that people use is very colorful. There is a lot of things that are in layman language, and there is a huge challenge to map the language that patients use to healthcare language and then unlock all the evidence that is available in patient-generated data. We brought together 4 main universities that have specialized in clinical healthcare, so University of Sheffield, Manchester, Brighton and Sussex, and we got experts here to see how feasible it is to extract information about adverse drug reactions and experiences that people have in an automated way to fill into yellow card system for pharmacovigilance. So the idea today is really to get collective view on where the state of the art is and what are the challenges in the time to come.
So we've taken 200 posts from HealthUnlocked. They're anonymous, and we've had a group of clinicians go through those posts and identify where a drug exists, where a side effect exists, or where an indication for that drug exists, and identify the relationships with those, and then shared those 200 annotated posts with the text mining community to see whether the computer can do as well as the humans in identifying the side effects within those posts.
And then the added layer is really that we need to make sure that from a platform point of view, from the user's point of view, that they are happy that their data is being used in a positive way for the research community. So we've had a good session on how to think about that both now and going forward for the future project. So we're looking forward to when the results of this type of work can then be fed back into a tool within the platform that helps them in some shape or form to report those effects, and then maybe to see that effect on the other patients that are in the community.
So for me as a researcher and as an epidemiologist, I am interested in analysing data across populations, but I can't analyse free text. So with the output of this work, we'll be able to study how many side effects there are with certain conditions and have a much better understanding so that we can inform patients and doctors so they can make better informed decisions about the treatments that they take.
It's been extremely exciting day for text miners because we were able to see what kind of issues and barriers we have in processing unstructured text from patients. So we have identified where the current state of the art fails and where there needs to be additional work to make data that is expressed in free text useful for epidemiology, for patients themselves to better find information to help them provide better quality of life.